Welcome to another episode of CHS Vinsiders, a podcast series where we delve into everything inside the College of Health Sciences at Vin University. This month, we will explore different career path opportunities for medical students. I am your host, Nhật Huy, and today we are joined by a special guest, Dr. James, President and CEO of ACGME International. Dr. James, thank you for being here today.
Thank you for having me. It's a true honor to be present during this podcast, and specifically with something that's led by the students here at VinUni.
Thank you. Let's dive right in. Dr. James, what factors influence your decision to join ACGME Internationals, and could you share the journey from your first day to your current role as a president today?
Thank you. I have been in my current position at ACGME International for 2.5 years. And I joined ACGME at that point in time after having a career as a cardiologist in the hospitals at Brown University and Yale in the United States, where I was a program director and faculty member and teacher. And when the opportunity to be able to contribute to medical education now in a global arena, in a much larger way than at one university, when that opportunity came up for me, it was an easy decision to join ACGME International and lead a great team at trying to improve medical education in the areas that we serve across the world. So for me, at this stage in my career, after I had been a faculty member and a teacher in the hospitals for many years, it seemed like the opportunity of a lifetime to be involved in medical education globally.
That sounds like a fulfilling journey.
Absolutely.
So can you give us a glimpse into a typical day in the life of a CEO?
Yes, there's no typical day as CEO of ACGME International, and I should say that it is much different, I'm sure, than being a CEO of a big corporation or company in that sense. In some ways, I still consider myself a medical educator. So my day is usually involved in either meetings with other medical educators discussing either their programs or strategies to improve medical education locally or regionally, or I might be involved in meeting with individuals from other parts of society that have an interest in medical education. These could be, for example, administrators of hospitals or the regulators in different countries, and to explaining what postgraduate medical education is and the benefits of having good residency and fellowship programs. And then I also still, on some days, I'm doing education to mostly faculty who are in our network. So my days are very varied. I also still try to do a little bit of research in medical education to help promote scholarship and promote learning in postgraduate medical education. And then, of course, because I'm involved in international work, some of my days are traveling, which is very exciting because I am able to visit places like Vietnam. This is my third visit now to Vietnam. I absolutely love it, and it's part of my job. So I'm very, very lucky.
That sounds both dynamic and rewarding
Absolutely.
at the same time, right? Now, I'd like to shift gears a little bit. Can you share some insight into various career paths available for medical students after they graduate?
Yes, that's a very important question because I think sometimes medical students or young physicians don't realize how many paths there are to success. So it's important to explore those paths. One way to explore it is by getting to know different faculty members. Each person, each one of us, has had different paths. And by learning the path of an individual, you learn the paths that might be attractive to you. So there are so many different paths. Some paths are primarily related to patient care and taking care of patients without much in the way of scholarship or teaching. Other paths, I took a path where the educational and teaching part of my job became the largest part. And those opportunities usually exist when you're at medical universities or teaching hospitals. And then other physicians take a path where their main and primary time is in research, whether it's basic science research or clinical research. So I would say when you're a student and a young physician, the way to explore it is by asking faculty members, different faculty members, and then you will learn about different paths. And you will naturally then begin to decide which pathway is right for you. And finding that right pathway is very important to a successful career.
As someone who has transitioned through different roles in academia, government service, healthcare systems, what suggestions do you have about transferable skills do you have for medical students to prioritize developing?
That's a very good question because although roles, if you look back on anyone's career, including my own, you might conclude accurately that my role has changed in very dramatic ways over the years that I've been practicing. But certain elements of who I am are probably the same. Some change, some are the same. I would say one of the many transferable skills is try to develop communication skills, which is very important. No matter what area you're focusing on, you have to communicate. And in this context, when we say communication skills for a physician, we sometimes think about the patient, communicating with the patient, which is important. But in this discussion, what I mean is actually communication skills with your peers, with your supervisors or senior faculty, and what you do in teams and in groups. Almost everything that I've done at different stages is not about the individual, but you're part of a team. You're working with medical education. It might be a committee. It might be a group of physicians and a society. To get engaged in professional societies is very important. So whatever that team is, you want to be an active participant in that team and communicate well in that team. So don't be afraid to join those teams and you'll begin to build relationships. Relationship building goes along with communication skills. And you begin to develop your own personal network. And that's really what I think is one of the probably several important elements to future success.
Wise advice indeed.
Thank you.
For medical students who are interested in leadership roles, whether it is in healthcare systems or medical education institutions, what are the opportunities are there for them?
I think when you are just starting out in medicine, the ways that you can get engaged include on several levels. One is on the hospital or university level, when there may be opportunities to join, as I mentioned earlier, committees or some groups that are engaged on a specific task, either medical education, maybe quality improvement. It might be related to very specific tasks on improving well-being or other initiatives that the institution will have. I would say that look to join those groups, the groups that you have interest in, on the local level, on the university level, or the program level. But there are also very likely opportunities for similar engagement in societies outside the university. Let's say you're interested in surgery. There may be the surgical societies of the country or of the world that have opportunities for students to be involved, or residents for sure, once you begin residency. Look to engage. If you're interested in leadership, look to engage in those societies, starting with the specialty that you're interested in, and then eventually that may build over time to a broader and larger role. So start first locally, regionally, and within your specialty, and then begin to branch out.
That's encouraging to hear from such an aspiring leader.
Thank you.
Talking about residency, I have a question regarding accreditation. Yeah, and so my last question is, what is the significance of accreditation for medical educations, and what is the implications for physicians practicing at Wien University?
That's a great question, and obviously an area that I have great interest in as I have focused this part of my career on accreditation. I think accreditation at this point in time brings two important functions, two important roles to the postgraduate medical education programs. That is what ACGME International accredits, residencies and fellowships. One role I would call the assurance role. And what we mean by that is that to be accredited means that a program has met certain minimum standards. So that brings an assurance to the community that the program has met standards that are internationally accepted across the world as a high quality program. But the other important function, maybe the most important function of accreditation operations in this era, is not just the assurance function, but the quality improvement function. That is, what we really hope to do is try to encourage not just meeting minimum standards, but always getting better, driving quality improvement, program improvement forward. If you're doing good today, we want you to do better tomorrow. And I think that's really the basics of accreditation. Of course, also, we have a very, very important function in improving the learning environment for our residents, students, and fellows. And by that we mean we want to be part of the process that helps ensure that the place where you learn, primarily in the hospitals and clinics, is a place that's conducive to learning, that there's fair treatment of residents and students, that the hours of your work are controlled to what's reasonable, that there's attention to well-being, which is very important for your whole career. but especially when you're starting, that there's a focus on making sure you understand when you're fatigued and how you address that. Those aspects, focusing on ensuring that the environment where you're learning is the best that it can be, I would say is the other major focus of what we bring to the places where we partner and serve.
Great. Thank you, Dr. James, for sharing your expertise and insight with us today. It's been a pleasure to have you on the show.
Thank you. The honor is all mine, and I would like to wish all the success and that is possible to all the students at VinUni.
Thank you so much.
Thank you.